And now, Closing the Gap in Healthcare with Dr. Thaddeus John Bell.
Am I too young for the flu vaccine? It has been difficult to convince young African American people to take the flu shot, my own family notwithstanding. This year, the CDC recommends the flu vaccine for everyone over 6 months of age. While younger people are less likely to develop complications of the flu, it is still recommended. College-age young people who experience flu-like symptoms are reported to do poorly on exams if they have the flu. Remember, African Americans have a high prevalence of chronic medical issues, and without the flu vaccine, we are at high risk for complications and death. I'm Dr. Thaddeus John Bell, closing the gap in health disparities for African Americans and for the underserved.
And now, Closing the Gap in Healthcare with Dr. Thaddeus John Bell.
Cephas, the last time we talked, I told you that somebody said your girlfriend might be HIV positive. Now, did y'all sit down and have one of them discussions about HIV/AIDS? You need to tell that girl y'all need to be tested before y'all have any more relations. Now, I would recommend that you have a good talk about having an HIV test done. Now, don't put a lot of pressure on the girl, because she might run away. But if she run away, you better run too and get yourself to that doctor's office. Tell her about what you're worried about, Cephas, because it's both of y'all having some of them SUVs if you don't watch yourself. Let her know you're going to have an HIV test done too before y'all have any more relations. Make your first date, Cephas, to the doctor's office. Go get tested.
I'm Dr. Thaddeus John Bell, closing the gap in health disparities for African Americans and for the underserved.
And now, Closing the Gap in Healthcare with Dr. Thaddeus John Bell.
Men's sexual health. Here are a few tips that all African American males should use to help protect themselves and others from HIV and other STDs. Condoms should always be used when having casual sex. Know as much as possible about the history of your sex partner, male or female. Men who have sex with other men are likely to give HIV to his female sexual partner. Recognize that you can get an STD through oral and anal sex. If you have genital herpes, the affected person must protect the unaffected person by using condoms and taking medications daily. If you are having sex with more than one woman, you need frequent HIV and other STD surveillance. I'm Dr. Thaddeus John Bell, closing the gap in health disparities for African Americans and for the underserved.
And now, Closing the Gap in Healthcare with Dr. Thaddeus John Bell.
People act like traffic lights. People who have medical problems often act like traffic lights, making it difficult to do the right thing by them. Some folk are like red lights. They will not move no matter what information is given to them. These folk will have major medical problems and in most cases will die early. Then you have the yellow light folk. They do what is right for a while, then fall back to old behavior. They cautiously do the wrong thing and then wonder why the outcome is bad. Then you have the green light folk. Every physician likes to have many green light patients. They stop, look, and listen, then make sound decisions about their health. Traffic lights are supposed to make life easier, but if ascribed to people, that ain't necessarily so. I love them all, the red light folk, the green light folk. The green light folk, well, they are my kind of people. I'm Dr. Thaddeus John Bell, closing the gap in healthcare.
And now, Closing the Gap in Healthcare with Dr. Thaddeus John Bell.
An issue that continues to drive noncompliance in medicine is the lack of trust that many African Americans have of their physician as well as the medical establishment. I continue to be impressed with how pervasive this feeling is in the African American community. My own experience with this issue is notwithstanding. Just the other day, I made a recommendation to a patient regarding the addition of a blood pressure medicine, and the patient did not take my advice. I understand why there may be some hesitation. However, I recommend these facts to be considered. Make sure you understand the outcome of what is likely to happen if you don't follow your physician's advice. Ask yourself if you are in denial about what the physician is telling you. And finally, don't let a few extra dollars cost you your life. I'm Dr. Thaddeus John Bell, closing the gap in health disparities for African Americans and for the underserved.
And now, Closing the Gap in Healthcare with Dr. Thaddeus John Bell.
Waiting on the Lord. As a young boy, I can remember my mother saying to me, "The Lord works in mysterious ways, His wonders to perform." Many African American people will not accept medical care because they say they are waiting on the Lord. It is not uncommon for folk to take this attitude when faced with a life-threatening illness such as cancer. The miracles that God has provided for us is often pushed away because we do not understand and recognize that modern medicine is a miracle of God. The story that illustrates this is that of a man who asked God, why did he not come rescue him in his hour of need from the flood? And God said to him, I sent you help 3 times, and 3 times you passed it by. The miracle of modern medicine, it's your choice. I'm Dr. Thaddeus John Bell, closing the gap in health disparities for African Americans and for the underserved.